In this article, we discuss why the census is so important for children and what you can do to get involved. Census data is used to determine districting at the local, state, and federal levels, ensuring fair and accurate political representation. It is also used to allocate funding for over 300 programs that are vital to child health, including Medicaid, CHIP, WIC, SNAP, the Section 8 Housing Choice Voucher Program, Head Start, and many more. Despite the importance of the census for children, young children have a higher undercount rate than any other age group. It is estimated that in the 2010 census, 2.2 million children aged 0 to 4 went uncounted. That's the equivalent of not counting all of the school children of Wisconsin, New Hampshire, Nevada, Iowa, and Maine combined. Among children, there are certain groups that are especially high risk for being uncounted. These include infants and young children, racial and ethnic minority children, those living in complex households such as being co-parented or living with grandparents, children with prolonged hospitalizations, those in the juvenile justice or foster care systems, children who live in low-income neighborhoods or who are homeless. This map shows the hard-to-count neighborhoods in Boston, and you can visit this website to look at hard-to-count neighborhoods in your own area. The goal of the census is to count everyone who resides in the United States on April 1st, 2020, regardless of immigration status, race, ethnicity, income, age, or relationship to others in the household. The census can be filled out online, by phone, or by mail, and will be available in 59 languages. Reminders to fill out the census will be mailed to homes beginning in March and April, and in May, enumerators, the term for census officials, will begin visiting households who have not filled out their census via these other methods in order to help them complete their census. We must promote the message that the census is safe. There will not be a citizenship question on the 2020 census. Census responses cannot be released to anyone, including landlords, government agencies, immigration officials, or law enforcement. And enumerators are sworn to protect respondents' data. In this article, we discuss what you can do with just a few minutes, a few hours, or more to help ensure that your patients, employees, and communities are counted. This is an example of a frequently asked questions flyer we created to distribute to providers in our area and is available on our website for public use. We also held a special grand rounds during Latino Heritage Month about the importance of the census, and you could put on a similar program at your institution. We are organizing volunteers to staff tables in clinical areas and waiting rooms where patients, families, and staff can complete their census on site. And we'll be hosting a social media campaign and educational event on April 1st, Census Day. For more information, you can visit our website, seen here. You can visit 2020census.gov, or you can look for complete count committees in your area. You can also participate in national campaigns through professional organizations such as the American Academy of Pediatrics. As pediatric providers and institutions, we serve as trusted messengers for families in the community, and we have a responsibility to advocate for our patients. Please ensure that every child counts in 2020.